It is just a huge honor for me today to be podcast interviewing Dr. Takeisha Presson, DDS, a native of Washington, D.C., who earned her Bachelor of Arts in Zoology with a minor in Spanish at Ohio University. After working several years as a biologist for the Center for Food Safety and Applied Nutrition, a branch of the FDA, she decided to pursue a career in dentistry. After obtaining certificates in dental assisting from Prince George's Community College, she began working as a dental office manager with a reputable dentist in D.C. It was there she discovered dentistry was her passion and her innate need to desire to give people a reason to smile. Dr. Presson attended and graduated from Howard University, which was obviously named after me, with a Doctorate of Dental Surgery, and completed a general practice residency at St. Elizabeth's Hospital, who I guess was my aunt or was someone else, a public psychiatrist hospital for civilians and criminals, which triggered her interest in mental health. Dr. Presson is currently a member of the American Dental Association, the National Dental Association, the Academy of General Dentistry, American Association of Women Dentists, and Alpha Kappa Alpha Sorority, which was started at Howard University, by the way. She regularly attends continuing education courses to keep abreast of the latest dental treatment recommendation, materials, and technology. She is a gifted clinician, passionate about educating her patients on best oral hygiene habits and oral disease prevention. Her ultimate goal is to give them a reason to smile. Recognizing good dental habits evolve from relationships. She enjoys getting to know her patients, whom she considers her family. Her relatability and skills have made her a highly sought-after dentist. When she's not in the practice, she enjoys traveling, singing, dancing, eating Maryland blue crabs, and serving the community. Her dedication to service contributed to her founding Dimples Dental Suite Foundation, a 501c. A portion of the practice monthly proceeds goes to the initiatives. And she graduated from Howard University in 2008. And I told her before the show started that since her name is Takeisha, if she ever has a daughter, Takeisha should name her daughter Take Issue With. What do you think, Takeisha? Take issue with. My God, can you imagine always introducing your daughter as, here is Take Issue With?
Listen, anyone that knows me, they know I have a dark sense of humor, so they would find that hilarious. Trust me. Poor child. They'll find another nickname for him.
And I think I should just take 1 minute to say something today. We have today was a very sad day. I just I emailed you this right before the show. My gosh, R.I.P. to Dr. Eugene J. Jordan, DDS, who died August 28th at the age of 83 years old, a beloved dentist known for giving back to the community and championing social and cultural changes. His dental practice made it a mission to serve children and others in Cleveland and East Cleveland who couldn't afford one. My gosh, the doctor was heavily involved with the NAACP and once served as the president of the National Dental Association. He was also instrumental in helping to establish the Black History celebration in Cleveland and bring Juneteenth celebrations. So that's my middle name, Eugene. Howard Eugene Friend. Dr. Eugene Jordan, thank you for a great life. I'm sorry to start on that down note, but I had to do it. But how are you doing?
I'm actually doing well, but I wanted to say after hearing that and reading his bio, I mean, I just want to thank him for his life, because he blazed so many trails. And, just hearing and reading his biography, I know that he blazed some trails for people of color, in particular in the dental field. And so for that, I just want to say thank you. Thank you.
Oh, man.
Thank you for his life. Yeah.
And that's, a lot of people always try to find the meaning of life, and I like the one from the Boy Scouts the best. Just leave the playground better than you found it. And I'm always telling my 4 boys, didn't you kind of like being born in the United States and from 1989 to 93? I mean, we already had roads and bridges and dams and nuclear power plants and the electric lawnmower. I mean, just keep it going. I want to get right to the meat of this. How has COVID-19 impacted you? And for the most part, you're in downtown Washington, D.C. Is that right?
Yep.
So what has it been like there? Because the term United States, I mean, it's hard to compare Alaska to Miami or Albuquerque to Manhattan. So what's it look like where you're at in Washington D.C.?
I will say, okay, are you talking about 3 months ago versus today? Because I want to make sure I answer your question. Because 3 months ago, which one are you referencing? And I'm going to
do the whole thing. Start with 3 months ago. Walk me through the journey.
Okay. So my journey with COVID started in February. I could tell that something was coming down the lines, like people were whispering about something. You know, I have a faithful clientele, and when people started to call the office and say they need to reschedule, I didn't understand what was going on. So at this point, I started to redo my research, start to Google, and I realized there's this virus that is just taking over. And right now it's up in Seattle, Washington, and they are predicting that it's going to head towards us. So March comes. First week of March, I come up with all these plans for how I'm going to get through it. As a matter of fact, I had a conversation with my landlord because I am a business owner, as you know, in DC, but I rent my space. I had a conversation with my landlord. I said, I hear that something is about to come down the pipe that's going to affect our businesses, and I think we're going to be closed. My landlord thought I was crazy. I said, do you have any provisions in place for your tenants if they have to shut their businesses down? He didn't have an answer. I said, I think you need to come up with one because something is coming. Second week in March, the mayor declared and decreed that all non-essential businesses needed to close. Here's the issue. Dentists were considered essential businesses. We were essentially open, but here's the problem. We could only do, per the ADA recommendations, emergency services or non-elective procedures. Now, again, normally wouldn't be a problem, but in my particular area of DC, we didn't have a surge in people that had emergencies or that had non-elective procedures that need to get done. So not only am I dealing with the population that didn't necessarily need me, but I was dealing with, now all of a sudden, overnight, the price of everything that we use went straight through the roof because the Congress decided all of our personal protective equipment had to be outsourced to the hospitals, and then they somehow put in the fine print nursing homes. So I found myself 3 months ago in a situation where, okay, I didn't necessarily have patients that I needed to treat, but I didn't have the supplies, and I was forced to essentially close my business. All right, so how does that work when you have bills that have to be paid? I read your book, Uncomplicated Business.
Thanks.
That's why you made me nervous. Once I realized who I was talking to, I was like, wait, hold up. We'll talk about that. But I realized in that moment, I didn't have a plan. I literally just started my business 3 years ago. I had a plan to move forward, but I didn't have a plan for COVID. So 3 months ago, what was it like being in the nation's capital? Everything is shut down, but the government tells you that you must remain open because you are an essential business, but you have no income coming in, or we're going to talk about that. We're definitely going to talk about that. No income coming in, and you don't have the resources that you need. It was a nightmare, a complete and utter nightmare. 1 week of being closed, the second week, all of a sudden, my phone is ringing off the hook. People realize I'm open, but here's the problem. I don't have the resources. I only had a certain number of gowns that I could spare. I didn't have any N95 masks. You know, we're dealing with, CDC and OSHA not really knowing what's going on. So there wasn't a whole lot of guidance. Fast forward now, 3 months later, we still don't have the much needed PPE, but we're in phase 3 here in DC. So I now can treat all patients, but we now have guidance from the American Dental Association, the CDC, and OSHA. So that helps a whole lot.
And it was sad because, the ADA, if they ever go to court, like when it was Texas, when a guy said, I'm a specialist, and people said, well, that's not one of the specialties recognized by the ADA. They said, well, the ADA it's a membership club. It's not a government agency. So move them aside, you're down to CDC and OSHA, and they weren't even on the same page.
Nope.
I mean, it's like, how can you can bounce 3 government websites. It's like, you guys don't even have your story together.
Yep. And that was the problem that I found. It's like you want to do what's best for your office, your staff, your patients, yourself, but then you don't know how to move because you're getting inconsistent information. But here's the thing, as I told people, because COVID, the virus itself was so new, every day was going to be a discovery period. And we needed to allow each organization grace to come up with a plan. And that's what the problem was. Everybody wanted answers that just could not be given in the time frame desired by all of us.
And then what's really sad is, I mean, there is no future or past. There's only the present in physics. I mean, you can't walk your kid out on the porch and point at where the Big Bang was, because that was 13.8 billion years ago. It's gone. So no one can tell you the future of the price of the stock market, where the virus is going to do. I mean, they talked about a fall surge. I mean, we're in September, and if you remember when we were back in March, April, May, everybody kept saying, okay, this is going to die down in the summer and come back with a vengeance. And now there's 10 different theories on that. Look at the NASDAQ. It's been hitting all new highs of all time, while 40 million Americans lost their job. And I got an MBA, and I'm looking at this saying, okay, there are no legs to that camel walking around Wall Street. I mean, its legs are missing, but the camel just keeps drifting high. I mean, this is, I consider these times pre-COVID and batshit crazy. I mean, because I mean, we don't know. I mean, we're both sitting here. You don't know what's going to happen in September, October, November, December. I mean, what do you think? What do you think it's going to be like? Pretend we're on New Year's Eve right now, and we're singing to Prince, 1999. What do you think it's going to look like at the end of the year? Do you think it's going to keep getting better? A vaccine come out, back to normal, or do you think it's going to get worse, stay the same?
I think we're going to have our version of the new norm, and that's going to be everyone partying with their chin guards on. You know what I mean by that. No one is wearing the mask properly. I shouldn't say no one. A majority of the people are not wearing the mask the way it's intended. So I have been out and I have watched people with the little mask dangling down, or it's covering this. So what's going to happen at New Year's Eve celebration? There's going to be everyone partying with the little chin guards on. Now, what I do think is going to happen, not to be mean, but I do believe that the COVID virus is going to continue to mutate. And as long as it continues to mutate, there are going to be some casualties. There are going to be some casualties, and you just better pray like hell that you're not one of them. You know, I try to be smart, you try to be smart, but at the end of the day, you can't really tell people. We can advise them, but it's not so much we can do to get people to abide by rules and regulations, whether it's in a dental office or whether it's in a restaurant. You know, I get to see the whole gamut. I always tell people I am a patient, provider, and a patron. You know, I'm the 3 Ps, you know, so I see it from all angles. I just think that it's going to be difficult. And when it comes time for New Year's Eve celebration come next year, we're all going to be partying. I'll have my mask on, but there'll be lots of people with chin guards on.
I always watch this number. I don't like to watch case numbers because that just depends on how many people they've tested. So I just like to take the recovered, which is around the world, which is 19,798 divided by the people who died, which is 328,000, and it's so 900,328 divided by 19,798,909. It's about a 4.5% chance that if you get this virus, you'll die. And for some reason, it likes older, fat guys like me. If you're a male, even male pattern, no, I'm serious. If you're male, have male pattern baldness, over 60, obese, I wouldn't say I'm obese, but if you look at me long enough, you'll get a root canal. I mean, so I always look at it as I'd have a 4.5% chance dying. But what really scares me is I'm afraid they're going to do all this stuff for a vaccine, But then you're reading the epidemiologist saying this thing's mutating big time in different places. Could you imagine if this turns out to be like the influenza, like you got a flu shot this year, but it didn't work on this version? So we finally get through all this, but now there's a new mutation going, you know, like the flu, like your vaccine would only work for one version.
Did you say imagine? The data shows that it's very similar to the flu.
Yeah, so, no, but I mean,
no, but seriously, one might argue that it's going to be just like it because it's already showing the pattern. It's already showing the pattern. I think that's exactly what's going to happen. By the time they get ready to come out with the vaccine, it will be null and void. You know, and I'm all for promoting vaccinations, but I think that this one, we're not going to be able to move fast enough for the mutation. We're not going to be able to. And it's just, it's a fact. The data is already showing that. And so it's interesting because I have a morning huddle with my team daily. And part of it, I do use the COVID screening checklist, hazardous risk checklist that the ADA provided, because people do want to know what's going on. And so when I ran the numbers with my team and I mentioned, you know, if you look at how many people live in DC, 700 and something thousand people, according to the most recent census. And when we saw at that time, I think the other day it was like 13,000 cases. You do the math on that. That's like 1% or not even that. And then when you calculated the deaths in that, it was 0.5%. So here's the thing. I understand that maybe our numbers are low because we did shut down and we were on the forefront of making sure, you know, our mayor was very aggressive with the shutdowns and the closures. And so we did not get the COVID crises that they saw in New York and that they saw in California and in Atlanta. We didn't get that here in DC. However, statistically speaking, those numbers are so similar to the flu. We already know, statistically speaking, there will not be that many people that will die in this area. And it's literally because of the numbers that are put out there. This thing is parallel to the flu. It's very much parallel to the flu.
So for international viewers,
people like to hear that.
They all heard about the New York City thing. That was a complete crisis. How far away is Washington, D.C. from New York City if you got in a car and drove down the highway?
The way I drive, 3.5 hours.
Oh, so it's that close. So that's very close. And that's an interesting, I really like that. If you look at the globe, I mean, 70% of the globe is just water. And if you remove the water, it's 90% desert. But when you look at the 8 billion humans, they're only on the land, but they're only on like a very small part of the land. But there's a couple of dozen of these 50 million person strips. And that's the big one in the United States, from New York to Baltimore to Washington, D.C. I mean, it's a 50 million strip. So you'd think something contagious like an airborne virus would be very fluent up and down a corridor of 50 million humans all living in the same area. So how have you adjusted? What do you think the biggest adjustment you've made since COVID? Do you have less staff, less hours, more hours? Start with staff, because because a lot of staff didn't want to come back. I mean, there was a lot of hygienists and assistants that said, some of them, you know, their grandma lives with them at home. They have kids, and they're just saying, you know what, this is a novel virus. Nobody knows what's going on. Did you have a reduction in staff out of just pure fear?
I didn't reduce my staff out of fear. I reduced my staff because of economics. I just could not afford to maintain them. One of the things I take pride in is it's been very, very hard having a boutique style practice in DC. In this era where dentistry is moving more in a corporate direction, my practice is boutique style. It always has been. I built it on the philosophy of one patient at a time. You know, I never ever double and triple book my patients, right? So because I already had certain provisions in place, meaning I was accustomed to not having a whole bunch of people in my practice, and I do have a full operatory practice, and it's a nice size, but everything is every operatory is compartmentalized, so it's not an open bay or anything like that. Because my office was designed for one patient at a time, And because I've always been, I have OCD. Can I have that slight confession right now? So my OCD is just like over the top when it comes to cleanliness. My patients, and I think it's a true testimony for what I do, they said if they didn't feel anywhere else safe, they felt safe in my practice. So people were genuinely upset that they could not come into my office because they know I'm, about making sure things are clean and on top of things. I'm just on top of stuff and carrying guidelines and regulations. Like my OCD is just over the top. So that benefited me. When it came time for the staffing, I didn't have the money. No patients, no money. And unfortunately, the PPL did not afford me the opportunity to really be able to pay for my staff. Some people, and then when you get down to the economics of things, DC is very high. The cost of living here is high. The rent, everything is high. There's no way to get cheap. It's more expensive here than it is, like you said, in Omaha, Nebraska. So when you take those numbers and being mindful that the cost of living in DC is more, there was no way I could sustain my practice with no income coming in and keep my staff. So for making an economic decision, I chose to let my staff go. And I let them go. And they were texting me like, when are we coming back? They were ready to come back because they knew, if nothing else, I was going to make sure that, they were covered and protected.
So DC is pretty small, isn't it? Like 10 mile by 10 miles square. I'm going like back to,
but yes, it's very small.
And do you work and live in that little DC square?
I do. I live 1 mile from my practice.
So do you walk, or do you have to have a car park for a garage, or?
I do both. I walk and I do a shuttle. So I have a shuttle that actually runs by my practice. So I do both.
So would you put that in? Have you ever lived anywhere that was lower overhead? Like, if you ever lived in a more middle class rural area, where else have you lived?
Oh, and I do need to correct you. I attended Ohio Wesleyan University, not OU, not Ohio.
I couldn't say the word. I was looking at it, and it was like, I remember looking at it. I was like, oh gosh, she with a minor in Spanish at Ohio. What the hell? So I just went to university. I didn't know Wesleyan. What do you?
Yeah, Ohio Wesleyan University. It's actually in a very small town, Delaware, Ohio. Back then, it was not heavily populated. So that to me was a very rural setting.
So how much cheaper, how many times more expensive would it be to live in DC than Wesleyan University?
Oh God, the rent back there was like maybe $600 for a 1-bedroom versus in DC, you're going to pay about $2,000 minimum for a 1-bedroom.
Oh, wow. That's 3 times the cost.
We're not even talking about the square footage. A 1-bedroom, and I say 1-bedroom, but it could easily be like 600 square feet.
Huh. So some people are at the other end of the $50 million human strip are saying that they think New York City will never be like it was. Now, that's pretty doom and gloom, but do you see, I'll say it like this, working from home, when this hit, obviously my dental office is a B2C, business to consumer, it's retail, but my Dental Town magazine is B2B. There's no customers or humans that comes in here, and they had been asking to work from home for decades, so we were all set up for that. So that trend was already starting and accelerating, and I think all the pandemic did is took existing natural inertia and just shoved it to the other end, and now all these people at the other end thinking, I don't want to go back to the way it was. So I'm wondering how a big city like DC and New York City, I wonder what the new normal is going to be.
It's interesting you should say that, because if we could work from home in patients' mouths using a robot or something like that, that would be so freaking awesome. But that's just not our reality. I think that when it comes to DC, I think DC is pretty much on the spectrum with New York City. We're not going to come back. I believe that. Listen, I'm seeing things. I have neighbors that have businesses that they are now going to be forced to file bankruptcy. I have neighbors that are my neighboring businesses that cannot reopen because they just cannot afford to reopen. I live in a building where they lost 48 tenants because they just could not afford their rent. They could not afford to live here anymore.
48 tenants?
48. I had there are about 300 and something people in this building, and 48 people moved. 48 units became vacant during this whole period. The reality is the economy is just not there. It's not there. I jokingly tell my staff that it's an employer's market right now. We get to decide what we can pay people. And if you want a job, we can pay you the bare minimum. And again, it's not because that's what we want to pay you. It's just we now have little income that we're expected to do a lot with. The restaurants can only see 30%. On average, the restaurants can only see about 30% of the customers that they saw before. Thank God my business was structured in a way where we only saw one patient at a time. However, I'm noticing what's coming in. Because people have lost jobs and there are more people on unemployment here in DC, that means that there's an increase in people on Medicaid. And so they're now getting subsidized health coverage. And so that means more people are coming in that can't necessarily afford the dental services that they need, but they need work done. And so what's happening is you have more people, if they have good credit, tapping into credit to get their dental needs met, to get their home needs met, to get their food insecurities met. So there's so many different dynamics, but DC definitely was hit hard. We were hit hard on so many different spectrums, and I do believe that we will not come back from it. What's going to happen is that there's going to be a new redefined norm. I believe that the cost of living is going to have to go down. And though we are up in the tier with our minimum wage in the country, they're going to have to reconsider that because they know that people cannot afford to pay people the minimum. We just cannot. Everything has changed. And so city council, they're going to have to establish new norms. The mayor, they're going to have to get together and establish new norms, or otherwise this is going to be a ghost town. People are already leaving. I feed the homeless every month with my practice. I now see new people that weren't there before. There are more people in the tunnels. They weren't there 3 months ago. So we're going to have to establish a new norm in order to jumpstart the economy and get people back in housing. Because as a business owner, a landlord doesn't want an empty property. Money is made by having tenants. And that's just my perspective.
It's so bad, and I never want to discuss religion, sex, politics, violence, whatever. But the not just I'll just talk for the whole herd of 8 billion Homo sapiens. Almost at least 80% of them are under just incompetent management. Mm-hmm. I mean, just at least 80% of the 8 billion people are living under complete incompetency, and they don't realize. I mean, and one of the things that's always scared me as I've read it through history is when people start buying food on credit. That is never a good sign. When you're having to buy groceries on a credit card that has a balance, the future is very not bright. And that's why I have no idea what Wall Street's even thinking about on the NASDAQ. I mean, sometimes in college you could kind of knew where the party was. Mm-hmm. That's the LSD acid party going on in America because, I mean, like I say, that camel doesn't even have legs. It's just looking at like, what the hell? And then 40 million people lost their jobs, 30 million of which have had dental insurance. And we don't know how many of those jobs aren't coming back, but it's going to be a lot of them. Are you a Medicaid provider?
I am.
Oh, you are? Okay. So for the international deal, I know most countries are normal and they have like one policy for the whole country. In the United States, you have a federal policy. That's called Medicare. But then you got 50 states, and they each have Medicaid. And the difference between the United States and the EU is in the EU, Brussels is a toothless tiger, and each state is a national country with a military. In the United States, each state is a toothless tiger, and the head thug on the block is where you live, Washington, D.C. Thank you very much for living where the overlords live. So Medicare doesn't cover dental. And so when we talk about Medicaid, it's kind of crazy because each state has a different story. But tell us your story. And your story is even crazier because Washington, D.C. isn't even a state. It's not even in a state. What exactly is it? It's just a capital, right?
Capital of the United States, but we are fighting for statehood because we do have taxation without representation. We pay heavy taxes, but yet we don't get the funding that we need. And that was evident during COVID-19. When you think about how much of an impact the pandemic was on our city, and to get less funding than Puerto Rico, which is a U.S. territory, that was insulting. I pay taxes. I pay a lot of money in taxes, but yet I could not get the help that I needed. So, yeah, we're the capital of the United States. But here's what I think.
If I had a choice between, okay, do you want to make the 5 million people in Washington, D.C. a state, or break up Vermont into North and South Vermont, making it 2 states? Wouldn't you break up North and South Vermont? So like North and South Dakota. I mean, come on. Don't you think those people in Vermont need to be broken into 2? But anyway,
they need to get stuff together to figure out how to be one.
Well, yeah, I used to always say it in Omaha, and people from Nebraska thought I was crazy. But when I was in MBA, and when I was taking a business class in Omaha, Nebraska, I used to look at the data of North and South Dakota and think, well, someone needs to fall on a sword because one state government could do the services for both states, and you could lower your cost in half. Mm-hmm. And I always said, why don't they just make it Dakota? And my teacher, I can still remember asking my teacher that. And he just like, just go away. But anyway, so tell us about Medicaid. You participate in Medicaid, mm-hmm. and tell because a quarter of our viewers are still in school. So what's the difference in being a Medicaid provider and a Blue Cross and Blue Shield or Delta provider?
In DC, as far as I'm concerned, nothing.
Really, nothing?
Here's the thing. DC is, I wouldn't say we're an insurance-driven city, but we do have a majority of our patrons have some type of dental insurance. DC used to be a government city, where people had either federal government or city government jobs. And so by default, they had benefits, whether it was healthcare and dental and vision. So we are, for the most part, an insurance-driven city. And because of that, I say there is no real difference in terms of what you see and expectation. You will be surprised, like, who is on Medicaid and who isn't. Now, let's talk about the reimbursement. Reimbursement, again, is not that different. The argument I just had with the, let's just say, allegedly, CareFirst Blue Cross Blue Shield. How can you pay someone the same amount of money that you were paying them 10 years ago, but you expect them when everything has increased? The cost of living has increased. There is inflation everywhere. Why am I getting the same amount of money that I would make on a Medicaid patient? But there should be some type of eliteness that comes with having private insurance. You would think that if you're paying something out of your check every 2 weeks, that would put you at a certain tier. Unfortunately, in DC, the reimbursement rate is very similar with a lot of those insurances, so it means nothing. Now, DC Medicaid is different than Maryland Medicaid and Virginia Medicaid. DC Medicaid is probably as close as you're gonna get to a universal healthcare system in DC. It covers a whole lot. They give implants, they give dentures, they give nice crowns. They really do take care of their citizens. DC takes care of their own. The issue then becomes the fees, the reimbursement rates are equivalent to what they were 10 years ago. I cannot stress enough. Everything has gone up in DC. My rent 10 years ago in DC was $500 cheaper than what it was or is today. Why am I still getting paid at the same rate? So being a Medicaid provider, I will say this. Please know that you're going to get very few thank yous. But the reward of knowing that you're taking care of people that need you, that far exceeds what comes out of others' mouths. Private insurances, well, it is what it is. It is what it is. There's no gratitude that really is to be expected with that. And that's because they assume that their insurance is paying us more. And the reality is they're not. They're not. So I personally choose to see Medicaid patients because that's my way of giving back. I grew up, a little bit of my background. I'm first generation everything. I grew up in a public housing development here in DC. So I'm a Washingtonian through and through, first generation everything. So if it wasn't for Medicaid, I wouldn't have this smile, I wouldn't have this healthy body. And so my way of giving back to the system that helped me get along in life or get to where I am is to make sure that I give that population, the services that they deserve to have, whether they have the money or not. So that's why I am a Medicaid provider. I know that I'm not going to get the thank yous. I know that not everyone is going to understand why I do what I do. So it has to be something larger at play for me. And for me, that's why I do what I do. That's my way of giving back. Now, when it comes to the private insurance, again, speaking on COVID, because I know we've been talking about a whole lot. When we talk about COVID, a lot of my colleagues and I are stepping away from private insurances. We're stepping away from private insurances. We found that the Care First, Blue Cross Blue Shields, the Deltas, the MetLife, the United Healthcares, they haven't exactly been supportive during this whole pandemic. And so how can you continue to support a business that doesn't support you? Because insurances are big businesses. And as soon as patients, because remember, I'm a patient and I'm a provider. When patients begin to understand that insurances are big businesses, they'll understand that they're in the business of keeping money and making money. They're the only ones, when you talk about Wall Street, they're the only ones that have been making money during this time. They haven't really been dispersing that money to the providers. We have put our lives on the line during this whole pandemic. We are essential, but we don't get the respect of being essential. We're essentially putting our lives on the line, but yet we're getting underpaid and overworked. Now, how does that work? You charge the dentist to keep the people or the patients out of the hospital emergency rooms because you need that space for real COVID cases. So you keep our businesses open, say that we're essential for emergencies only, but you don't help us when you know everything has gone up. So I don't have many choice words for insurance companies, but I will deal with Medicaid because again, that's my way of giving back. Your heart has to be in it for Medicaid.
So does that mean you're going to stop participating? I mean, are you going to cancel being
I've already started.
You've already started?
I've already started canceling my plans with the big insurance companies. I have eliminated 2 DC Medicaid plans. And I eliminated those plans because I wanted to make a statement. During a time when people are in crisis, how dare you put patients in a position to have to pay for services? But then on the flip side, how dare you put the doctors in a position where they can't pay their bills? You want us to see these patients, but the reimbursement rate is so low. There has to be a medium. And so when the 2 insurance companies didn't hear me when I was saying everything is going up, you're only paying me $50 to go into this office to see this patient. But the reality is it's costing me $200. Can you help me out? Send me PPE, send me something to help me out. Only one insurance, DC Medicaid administrator heard my concern and was like, what do we got to do to make sure Dr. Presson keeps doing what she's doing? Because if you don't have what you need, how can you treat the people? So yeah, I'm doing away with the private. I've already started. I can't continue to allow the big insurance companies to make all this money and then don't feel like they need to take care of their providers and their patients.
Oh, come on. The Delta CEOs, they only make about $1 million a year.
Exactly. And that's what I say. While they're sitting over there getting their 6-figure income consistently during the pandemic, I'm going in working for pennies on a dollar, putting my life on the line for your patients. Or shall I say your clients, because they're my patients. So it became a bit much. Wow.
These are just horrible times. I mean, I like what you said. It just is what it is. I always liked a poem growing up. Everybody always says it was Mother Teresa wrote it, but she absolutely did not write it. It was written by Kent M. Keith, and it was called "Living the Paradoxical Commandments." But you know it as the anyway deal. People are often unreasonable, irrational, and self-centered. Forgive them anyway. If you are kind, people may accuse you of selfish, ulterior motives. Be kind anyway. If you are successful, you will win some unfaithful friends and some genuine enemies. Succeed anyway. If you are honest and sincere, people may deceive you. Be honest and sincere anyway. What you spend years creating, others could destroy overnight. Create anyway. If you find serenity and happiness, some may be jealous. Be happy anyway. The good you do today will often be forgotten. Do good anyway. Give the best you have, and it may never be enough. Give your best anyway. And these are challenging times because you got to really look internally. I mean, it's easy to do it when your kids are 2, 4, 6, and 8 because they don't know any better. You have to swallow some pride when they're doing it in your 30s. That's why I said, if mine, you just have to, like my mother's 82, so she's turning into a child again, and it just is what it is. But how are you holding up? How are you doing?
I'll be the first to tell anyone this is challenging for me. I am a single woman, no kids, no husband, no significant other.
You can just say genius. You don't have to say single, not married, no kid. Just say, I'm a genius. Well, the number one cause of divorce is marriage. And if you want any type of financial planning, have no children. You don't save for college. You don't have kids. I mean, I just wish one financial planner would say the truth. Never get married and don't have any kids. End of lesson.
Well,
so you're a genius.
I agree with you on part of that. I agree with the never get married part, okay? And I'm a little biased. I said, listen, we're just going to have to take this old school. We're going to have to take a vow before God to love each other. We're not getting Uncle Sam involved, okay?
Yeah.
Been there, done that. But I will say I do want children one of these days. I want them because that's my legacy. I didn't do all of this for nothing. That's my lineage. And so yeah, I want someone or some beings to lead this to, but I don't necessarily have to have the husband for that. But being a single person during COVID, it hasn't been easy. And so I have relied heavily on my really good friends to hear me when I vent and when I need to cry, because generally I just don't think people get it. This is not easy. And especially when you got to go through it alone. Oh, baby, I wouldn't wish this on my worst enemy. Are we talking dental time or we going to talk about relationships? This has just not been easy. And so, but I will say the flip side, being single without all the extra baggage, I felt like that made me the perfect candidate to serve, which is why I didn't have a problem going into my office and seeing patients and making myself available, because I was like, well, I have no one to run home to. I don't have any kids already. So if something happens to me, well, I'll just say it was the Lord's work. It was my time. But as we can see, I'm still here.
Well, the funniest way to prove that marriage is just an absolute criminal racket is just say to your lover, say, hey, let's not get married in the United States. Let's go down to Aruba and get married, because then it's not legally binding in the United States. And like, no, I want to get married in the 14th District Court of the United States. It's just amazing. I mean, imagine telling your best friend, hey, if you want to watch football with me for the rest of your life, every game, we're gonna have to get married. And if you decide to watch the game with someone else, you're gonna have to give me your big screen TV and 4 bottles of Jameson. I mean, it's just. I do. I think it's a complete racket because I know so many dentists that are struggling and they're trying to do this and they're trying to do that, and you look at their overhead and they're paying $5,000 a month to some person they used to have sex with 5 years ago. And it's like, what the hell's that? What's that about? Well, we actually tied the knot and got married. Do you have any kids? No. Does she have a job? No. What could you do with that $5,000 a month here? Hire a productive employee? that actually made, I mean, we only have goods and services, so make me a sandwich or cut my hair, but you just can't sit there on the couch and demand $5,000 a month because of the marriage racket. I think a good way to jumpstart the whole economy would be to null and void all of my homies, what do you call it? Alimony payments.
Alimonies.
Yeah, just we ain't got time for this shit no more. I mean, talk about getting reelected. Why isn't someone campaigning on "I will cancel all alimony if you vote for me"? I mean, but anyway, we're getting sidetracked. But what do you no? When I talked to when I podcast the president of the ADA, Chad, and I podcast him, I said, well, what's got your attention mostly right now? And then he goes, the rising suicide rate. And there's a threat on Dental Town for suicide and a threat on what you were talking about. We even started a new forum for the single dentist. It's a, God, I forgot what it's called. But anyway, yeah, it's for single dentists because that's what people are reporting, that they're single dentists living alone. And it's just a bitch being alone during a pandemic. I mean, I don't care what that person looked like. You'd have to be drinking to go kiss a stranger in the middle of a pandemic, right?
That's exactly what this is like. I refuse to date. I refuse to cohabitate. I'm like, I'm good. I'm so good. I was like, if you think I'm crazy, I won't date a guy unless I inspect his mouth.
Now, is that what made you become a dentist, or is that something you learned after becoming a dentist? When in your journey did you arrive at this?
It did not make me become a dentist, but I realized the correlation when I was in probably my teens. I realized I would pay attention to, the guy's teeth. And if I liked their teeth, when was the last time you went to the dentist? I would ask those weird questions. And so now, of course, since I've been in the dental industry for about 20 years, I've been a dentist for 12 years, but I've been in the industry for 20 years. I've just always been like, I need to see. So if I'm anal about your mouth, you think I'm just going to go out with you and I don't know what your COVID status is? Are you crazy? I jokingly tell people, I said, listen, you can't afford me right now. You can't afford me for multiple reasons. First off, I'm high liability. But I need you to understand that if you get me sick, you're paying alimony, you're paying support, not alimony, but you're paying support times 4. You got to pay for all my staff members, me and my shuttle bus driver. Why? Because my shuttle bus driver takes care of me every day. So unless you can afford to pay for 4 people, you can't date me.
So do you see a lot of more single people in your age group? I mean, at the end of World War II, it was like 4.5 kids per family. Now it's dropped to 2. In fact, they used to talk about the population explosion as a country's when 80% of the women do not graduate from high school, you have like 4.5 plus kids. And when 80% do graduate from high school, it plummets down to under the replacement rate. I mean, the average family has to make 2.3 kids just to break even. And now they're saying that the population will never hit 10 billion. In fact, before it maxes out, it's going to start seriously contracting. You already got countries like Japan where every morning they have less people on the island than the day before. And economically, that's weird to look at macroeconomics and a shrinking public. I mean, it's real easy to grow an economy when everybody's having babies and they don't have washers and dryers and baby beds. But man, to grow your business and a shrinking number of people, do you see a lot more single, unmarried, not having children now than say of, the generation that went before you? Yeah.
Yes. Yes. And I think COVID is not going to help. I see that more now than ever. That was one of the things that that's why I'm so excited that I'm now able to see everybody, because I get to talk to my patients that I know are single and find out how did they survive during COVID? What are they doing to mix and mingle? How are they meeting people? What's the strategy now? Because whatever we had as a norm before, it's not there. We can't, our lounges are closed in DC. Our clubs are closed. And the way the restaurants are set up, you can't even sit at the bar to meet somebody, so if you say you need a table, they're going to sit you at a table that's designed for two. So you're looking like the lonely heart, and nobody gets to see you. So it's not any fun at all. Not any fun at all. So when you think about all of that, there's so many single people, they're not able to match up. So I do believe that the population is going to go down. I do believe that there are not going to be as many babies because people are not able to link up. And then believe it or not, it looks like on the news, people are being free, but I'm here to tell you in DC, people are not behaving as freely as the media would want you to believe. People are genuinely timid. They're afraid. They're afraid. We're like, no. Where's your mask? Where's your mask?
Well, it's a really interesting phenomenon how you can film. Everybody has a camera. Like when I was little, you had to save a long time to go buy some film, and it was either a 12 or a 24. You put it in a camera. It was very rare. You'd hardly take any pictures, and then you'd have to go get it developed. That would take 2 weeks, and then you get the pictures back, and half of them were duds. But now everybody's got the world's best camera right on their phone, and so you can take a picture or film an event. 8 billion people on Earth, and there's just this little bitty event, but it goes viral, and the whole world thinks the whole world is doing that, and they make money off of it's just trying to steal your time so you can view a commercial. But it is really a distorted reality we live in because you no longer know what's real or what's fake. I mean, the line between real and fake is really dissolving. So how's it look for you like today? Like what's your this week look like for you? Are you open for business? Are you seeing patients? What are your hours? Monday through
Thursday from 8:30 to 5:30. Then on Fridays where it's from 7 in the morning to 1 p.m.
Yeah, and is it steady? I mean, where are you at percentage-wise before the pandemic? I mean, are you at half your revenue, 2/3?
Nope. That's interesting. I'm glad you asked the question about revenue because when it comes to revenue, I am at half my revenue. When it comes to the number of patients that I'm seeing, it's the exact same. It's the exact same.
So you're seeing the same number of people for half the money.
Yep. Because what's happening, the people that I had to put off for those technically 4 months that we were closed, they're now rushing to get in to get all their cleanings and stuff done. And then the patients that want to come in, because I'm booked a month out. So they have to wait to get the work done that they need to get done. Or if we get a cancellation, are able to get in. I'm not making as much money as I was before because I'm playing catch up with those patients that I had to neglect when I was forced to close.
Okay, but why are you booked a month up? Why are you booked a month in advance?
We were closed 3 months. People wanted to get in once they found out I was back open.
My gosh, I'm gonna name this episode Howard Takes Issue with Takeisha. My gosh, she's booked a month in advance. I'm changing her name to Take Issue from Takeisha to Take Issue. So why are you booked a month in advance, and how could you fix that, or how could you solve that, or what's that all about?
I could solve that if I had more income to hire new people. The funny part is I knew once COVID was over or we were allowed to see more, I needed to get a hygienist. And to talk about what you were mentioning earlier, they don't want to work. They're afraid, they're scared. And if you don't know me already and you don't know how I run my practice, it's hard to get new people to come in and to buy into. I don't care if they talk to the people that are already there. I don't care if they talk to some of my patients. The media has them scared straight, or should I say scared jobless, or scared to the point where they're comfortable on unemployment. And so people do not want to work. So the way my model because I knew, if you shut down for 3 months, I knew that there was going to be a need for those patients once I got back open. If the revenue was there and the desire to go back to work by some, branches of dentistry was there, I need help. I'm booked out because it's just me and my team, my regular team. We need new people, but here's the problem. It takes money to hire new people. And even if we got the money, the problem would be, can we convince them that it's actually safe? I personally believe it's safe, but can I convince someone that's been sitting at home reading all these articles to believe that it is safe to be in a dental setting and that I'm going to make sure that they're safe? That's why I am booked a whole month out, because I don't have help.
What if there were 100 people who work in dental offices in DC, like hygienists, assistants, receptionists? What percent would you say are scared and don't want to come back to work because they think they're going to catch COVID? I mean, did it shrink at 10%, 20%?
I think it's more than that. Just on an informal basis, I don't have the data in front of me, but just from speaking with my colleagues, I want to say about 20 or 30. I was very blessed in the sense that I had the structure in place that they were recommending. But like a few of my really good friends that have practices where they were like working multiple patients at a time, they are suffering. Two of my friends will not be able to open their practices back up. They're filing bankruptcy. So it's hard. It's just, I think the only thing that helped me was that I had already had a structure in place that was, I guess, COVID ready.
Right. So usually dentistry has been divided into high fee, low volume, or low fee, high volume. And the low fee, high volume is really changed when you got to dress up like you're going to do a moonwalk just to go do a hygiene. I mean, it used to be for me, I numb up this patient, then jump in another room, see the crown, go over here, do a hygiene check, and then jump. I mean, I can't jump 4 rooms in 10 minutes.
Nobody can do that. Nobody can do that. And that's the problem. I can tell you, one day I tried that, right? I set it up where I said, okay, because something's going to have to give. I put a whole PPP outfit for this one patient outside that door. Then I put a whole PPP outfit for one patient outside another door. I put on tank top and leggings, right? An outfit that would not get me in trouble so that when I'm getting undressed in the hallway, no one would say, what is she doing, right? So I have my leggings and my tank top. And I go to put on all the PPE to go into the one room, and they tell me, okay, Dr. Presson, you're needed in out too. So I take everything off. I step outside the room, and I take everything off to go get undressed. I have my staff like spray me down in this sanitizing stuff. Then I walk over to the other room, and I put everything on. And sorry about that. And then I try to go into the other room, and I realize, oh, no. This is too much. My OCD couldn't handle it. Like my anxiety, you begin to wonder, like, did you bring something into the room? Did you not do something good? Did you do what was best for your patient? Did you do what was best for your staff? Nobody can do that. That getting undressed, and then those masks we wear nowadays don't help us breathe well. You can't breathe in those. I'm used to the surgical mask, the new KN95 or the N95. Like I had this strategy. I said, okay, I'm gonna get the half face respirators per room. It doesn't work. I tried it. A couple of my colleagues, because we were like, okay, if this works, this is what we're gonna do. We did it. It does not work, and that's why I say I'm just grateful that I already had a plan in place where, unfortunately, we are gonna have to focus on one patient at a time. That's going to be the new norm. And can I tell you, I'm kind of grateful for that because it allows us to get back to how dentistry used to be, about the patient.
Washington D.C.'s got it's saying right now that last assessment 5,322,000 people. What percent of D.C. is like so many people in Arizona where they think this is insane? It's just the flu. It just kills some old people in the winter. It's a complete insane overreaction, and they don't care. They'll go back to any dental office today in Phoenix that's doing it just like it was. Versus what percent is literally thinks this virus is serious, does not want to get it, does not want to die, does not want to blah, blah. So break up D.C. Into 2 D.C.s.
If I had to guess, I think it's only 20% of the population that think this is a joke.
Only 20% thinks it's a joke.
If I had Yes, I would say 20%.
So
I would
4 out of 5
say
people respect the virus.
20%. I
Huh.
would say 20%. But here's the thing. So when we talk about DC, we got to be mindful of what's going on right now. DC is heavy in gentrification.
Heavy into gentrification.
Yes.
Okay.
Back then it was majority. When I was growing up, DC was majority Black. It was majority people of color. It was a very diverse city, but diverse in terms of cultures, meaning we had people from other countries, but it was still majority Black. Now that DC is gentrified, what I'm finding is the latest census report told us that there are way more white people in DC than there were before. And the people that particularly appear to be not taking this as serious are the people of color. And it's mainly because of lack of education on the topic, lack of trust for the medical community, lack of support. You know, there's so many different things that are going on in DC right now. We could talk about how like a majority of the Black people live east of the river, and east of the river, they only have one grocery store. We could talk about how east of the river, they don't even have a hospital that will deliver babies. All the people east of the river, when I'm telling you that the majority east of the river is Black, must come all the way west of the river to have a baby, which is why we have a high birth mortality rate in DC. So when you look at the population of people that are not taking it seriously, it's because they have a reason to not trust the system. And so then when they see the data that says more of them are dying, they think that it's just the media misconstruing facts. And it's not until they see people like me that are like, no, this is real. I look like you. So I'm telling you, I'm not telling you this because I'm getting paid to tell you this. I'm telling you this because it's a fact. There are people like us that are being affected, and we need to be more aware and get tested. You know, we need to wear the mask, like take this seriously. I understand we want our social lives back, but this isn't something to play with, because I could be in that 1% that ends up dead. You could be in that 1% that ends up dead. I would like to be in that 60% that if you end up getting it, no, what is it? What was, I think the last report said that only 1% of the population. If you end up getting it, you want to be able to bounce back from it. I'm from that era where I grew up with chicken pox. Did you get chicken pox growing up? Yeah,
I did.
I had it multiple times. And so I'm not saying that you need to catch it so that, you know, you get that herd immunity thing. I'm not here to promote that. But I will say that I want to be in that population that if I get it, I survive. I thank God, I mean, knock on some wood, you know, we haven't had to deal with any positive results with my staff and my team and I, but with education, people need to know that this is something that should be taken seriously, so that if it just so happens you end up getting that positive results, the odds are in your favor for a speedy recovery.
Let me go back just to a little geometry or geology. Are you talking about the Anacostia River or the Potomac River?
Anacostia. That's right, baby.
So you're saying east of that river is where most of Washington D.C.'s Black people live?
Yes.
Is it more proper to say people of color than Black people?
No, you can say Black people. I say people of color because what we have found when I was growing up in D.C. in the 80s and the 90s, the Latino population was up northwest. So that's why I was saying DC was always majority. Well, I wouldn't say always. It was majority Black, but we always had other cultures present. We had a thriving Hispanic community, you know, people from other nations. But with gentrification, the Latino population that was up northwest was displaced. And so now east of the river is full of people of color, not just Blacks.
So gentrification is the problem with gentrification is when they start to go in, money starts flowing into a poor community and they start fixing it up and all that kind of stuff. It runs out all the housing for the poor. And so when someone says, I'm going to leave the suburb and go downtown San Francisco and fix this old house up. Well, that old house used to be poor, lower cost housing for the poor. it all comes down to zoning laws. You have this historic society. It's really an irrational, hysterical society. The entire state of Texas has no zoning laws. You could buy a house and tear it down and build the Empire State Building. And so when you hear all this baloney about, oh my God, what are we going to do about the poor in San Francisco? Okay, well, it was all created by the government mob through all their laws and regulations and bullshit. So what the mob does is they completely ruin something until you're just so brokenhearted. You go back to the same people and ask them to help you fix it. It's like, no. They screwed the whole thing up, and the only solution isn't changing more laws and regulations. It's just to get rid of all zoning. Like Washington D.C., like you can't build anything. It blocks the view of that. What is that? That phallic statue in the middle. That big phallic thing sticking up in the middle of the hill. I mean, really? So, this is why I can't stand the mob, because it's always people who have a lot of options that decide to take away an option from a guy that may be his only option. Why is it that people with 10 options, all they can do is take away the one option for my homie? You know what I mean? And I don't care if that phallic thing can be seen or not. Just get the government is the problem. And what scares me the most of millennials is it's like the government is their mama with a bottle and they're nursing them. And it's like, mommy, can you fix this? No, mommy is a really bad mobster, okay? And she created all these problems. So let's not go to mommy government to fix it. Let's see how we can undo the whole government thing. I mean, less government is the answer, not more government. But I like DC. You know, I'll tell you the truth. Out of all the cities I go to, I mean, good God, the monuments, the museums, the restaurants. I mean, the Natural Museum of History, you could spend 2 days at each one, and there's like 7 of them. I mean, there's just no stopping. What's that?
All of our museums are free. They're for the people.
And you have the only hotel that actually has a rocking chair. Like, people always comment, well, how's your room? It's like, what do you mean, how's my room? If you see my house, I'm in a hotel. It doesn't even have a rocking chair. Well, anyway, there's this city by, what's the city? It's where they dress up and pretend they're old characters walking around the street. Williamsburg. That hotel there, they have rocking chairs on the patio. Just like the grandma had, the big old wooden rocking chair. I'm like, really? I mean, really, I think it's just the greatest town to visit and travel. I mean, do you like it? I mean, that's all you've known, really.
DC's home for me. The interesting part is I did go away for 4 years to Ohio, Delaware, Ohio. I'll tell anybody that it was what I needed. I knew that if I was in an environment where I was able to party and do a whole bunch of stuff, I probably would not have finished. And so I needed that structure of a small town setting and a small school. And so when I actually lived over in Spain, I think that I attended University of Salamanca, which is in Salamanca, Spain. And I can tell you, I did a lot of partying while I was over there. So I learned very quickly that, partying doesn't necessarily work for me when it comes time to be successful in the education side. DC came back. Yes, it's home. Would I live somewhere else? Absolutely. But it's nice being able to tell people I know what it used to be. And I wanted to just make one comment about what you stated with the politicians and just getting stuff together. Again, I know we're not supposed to talk about it. I don't understand. DC has a rule where it says that any new building that goes up must have 20% of the housing must be for affordable, must have affordable units. And if the cost of living in DC or the median income is 80 or 90,000, I don't know who they think or where they think people are making that type of money east of the river. But if the median income is 80 to 90,000, but the average Black person in DC makes 40,000, how can they afford to be in those affordable housing units? The government, our local council, mayor, all of them put that in place. My patient said something wise to me over the last couple of weeks, and it's been resonating. It's been hitting home with me. I don't watch any sports other than UFC. I'm a UFC girl through and through. We could talk about that till we blow in the face. But if you talk about NBA,
USC,
NHL,
you said you're USC?
Oh, UFC, baby.
Oh, you saying UFC or USC?
UFC. Ultimate Fighting Club.
Oh my God. So, oh my God. Isn't that amazing? Did you ever think when I was growing up, the greatest event was always whoever Ollie was going to fight, Shavers, whoever it was. Did you ever think something would trump boxing?
No.
I mean, from the days of Ali and Shavers and all those guys, and then the UFC and oh my God, Joe Rogan, those guys. So you're a big UFC fan.
I'm a huge UFC fan. I am known for flying all over the country just to go see a UFC fight.
Who's your favorite fighter?
Alistair Overeem.
Alistair Overeem?
Yeah, I like heavyweight. I'm biased.
UFC, Alistair.
You got it like Anderson Silva. You know,
yeah.
He's just a legend.
Alistair, how do you say his last name?
Anderson Silva or
No.
Overeem?
Alistair.
Alistair, Alistair, Overeem.
Huh. Let's see if Google can find him. Oh, A-Star Overeem.
Yeah.
Oh my God, what a beast! Love that guy, and he's from London. You fell for the accent, really? You just fell. You what?
I did. I fell for it. Oh, I fell for it.
He is
I mentioned he can kick butt. Like he's a beast. But then locally wise, we have John Jones, if he can just stay out of trouble. But I love me some John Jones. And, you know, he comes from a family of athletes. Both of his brothers play, you know, in the NFL. One has a Super Bowl ring, you know. So when it comes to UFC, I can talk about it all day, every day. But I know nothing about the NBA, NHL. What is the other one?
NBA. And well, the
okay.
NBA.
So here's the thing. This is what my patient said to me. He said, Doc, if you don't think LeBron James and Dwayne Wade and Harden and all of them are partying and drinking together during the off season, you're a fool. I said, what do you mean by that? He said, you need to look at the Lakers and the Houston Rockets. I said, okay, I don't watch those, but I'm with you. He said, you need to look at the Lakers and the Houston Rockets like the Democrats and the Republicans. Again, I know we're not supposed to talk about these things, but he said they make decisions for us. But if you think that in the off time, they may bicker and fight while they're on the court, you know, and they're out to see who can actually win the people. But if you think in the off season, they're not hanging out on their yacht together, you're the fool. When he said that to me, I had an until people in Congress or your representatives start to look and behave more like you and I, we'll never fully be represented. I don't care what party you belong to. At the end of the day, we need people that are genuinely looking at the best interest of the people, period. And when my patient said that to me, I was like, wait, I didn't think about it that way. So while we're all fighting each other because I'm a diehard Redskin fan and you're a Dallas Cowboy fan, you know, at the end of the day, it doesn't matter. They're best friends in the off season.
Yeah. But, you know, when you look at the universe, 85% of all the stars are binary stars. Mm-hmm. And the Republicans and Democrats have been a binary star going the same direction for 150 years. One robbed the bank, one drove the getaway car. There's the largest party in America is the non-voters. Mm-hmm. And they don't vote because they know it's a sham. I mean, well, I'm supposed to die for democracy so that every 4 years I could get a pick between voting for an elephant and a donkey's ass. Really? That's democracy. And then the independent, my libertarian, I'm a registered libertarian. My registered libertarian, Jo Jorgensen, she's a doctor and can't get on any of the debates because you have to have 15% of whose rules are these? And the reason she won't be on a debate is because we have a binary star system, like 85% of those stars, and off season when they're not on the camera, they're drinking the same Kool-Aid, and the Kool-Aid is that the voters are the workers, and the rich Wall Street, the Jeff Bezos, whose wealth fluctuates several $billion a day, they're just employees for those guys. I mean, and people who are, when they're young, they still believe in truth, liberty, and justice in the American way. And when they get 58 years old and your 4 boys have turned into 6 grandkids, it's the biggest scam on earth. And at the end of the day, I can only tell you what's going to happen. The poor will get poorer and the rich will get richer, which is a cool game because it works for me. I'm on the rich side. Okay, but when you get really old, you realize, well, I ain't taking any of this with me, and I'm worried about my 6 grandkids. Like the day that Eugene died, my 6th granddaughter, Evelyn, was born. So, out with the old and in with the new. So I'm mostly worried about the next generation. As far as trying to stay in the present, I'm only mostly worried about the kids that just got out of school. So that's why my next question for you, what advice would you give to the COVID class of 2000? She just graduated 3 months ago, $400,000 in debt. She thought she was going to be a dentist in America and make some money, and now she's $400,000 in debt, and her government, even though the Constitution gives us bankruptcy protection, you can't bankrupt student loans. Yeah, so we went through this 500 years ago around the world where you'd go to debtor's prison, and our Constitution said, no more debtor's prison, you have the right to bankruptcy. And even with 50,000 suicides a year, your congressman and your senator still will not let you bankrupt your student loans. So she's got $400,000 of student loans in the middle of the pandemic. Talk to her.
My advice to her, whatever you thought you had in mind, it's not that. It's not that, and it's not going to happen. If I would have known that this was coming, get you a regular job, define what regular means to you, and that I'm tongue-tied. What does that mean to me? Peace of mind. I cannot be in a corporate setting. Get you a regular job and start to save your money. Pay the bare minimum on your student loans because you have 30 years to pay that off. Find ways to strategically get your student loans paid off. Meaning, if you have to humble yourself and take the $100 and something thousand and then get the loan repayment money, do it, because guess what? Nothing is going to happen fast over the next 6 years. The money that we were making before, we're not going to make it. So what time is better than now than to serve and get paid to serve? I actually can admit I was one of those people. As much as I like to serve, I was determined not to go and do one of those loan repayment programs. I was like, oh, no. I want to do implants. I want to do this. I want to do that. I am not going and working in Idaho for $100,000. While the world is trying to figure itself out, now is the best time to go serve there. That way you have stacked your paper for the next 5 years or 4 years, so that when we have this thing figured out, you can emerge and open your own practice, buy into a practice, do whatever you feel like you need, because at this point, the norm will be established and you will be financially stable. Now is not the time to go buy anything. Think about some things. I wouldn't even buy stock. I would be watching things, but if I could do it all over, if you just got out of school and you got your $400,000 that you need to pay off, look at avenues of how you can get those loans to work for you. Do not be in a hurry to go work for someone else, because the bottom line is everything is still being developed. We're still in the middle of a pandemic, and it's going to take years before they establish this norm. Years. You have time. I think
not just was 2020 dead on arrival the year. I think the decade was dead on arrival. I think 2020, the decade till 2030, I mean, I don't see my gosh, just 10 years ago we had Lehman's Day, and we had that big meltdown. And that meltdown would be like, my God, Roy Jones just sweeping your foot out.
Mm-hmm.
This coronavirus was the 1-2 punch. But I want to ask you another question.
Another thing I would tell my colleague too, now is the time when you can tap into your other skills. You better have multiple streams of income. The day and age of us just being dentists no longer exists. You don't have to be that. So if you were interested in doing a podcast, if you were interested in having a clothing line, starting your own toothbrush line, starting your own whitening line, now is the time to do your research and do those things, because having just that one income is still not going to work. So use this time, even though you have your $400,000 in debt, use this time to plan, as I call it, dream, plan, and execute. Dream about what you think you want to do, plan it out, and then execute. Because
all right, well, then tonight I'm going to start my cannabis mouthwash project that I've been thinking about for a long time, because I really think cannabis mouthwash will kill germs that cause bad breath.
I don't know if it will or it won't, but I'm going to tell you this much. 5 years ago, I wasn't thinking about learning about cannabis because they had us convinced, oh no, it's so taboo. Guess what? There's so many, it's a huge industry that just showed up 5 years ago. We need to know what's going on. And if we can be involved with it, either directly or indirectly. Because if I see one more CBD vitamin, rub, or CBD, something that's so-called going to help somebody, I want to be able to explain to my patients, is this really beneficial, or is this just the latest crop, like the charcoal toothpaste? Yeah, I said it.
Yeah. And again, you just gave another, CBD infused mouthwash. And I'm sitting here in Arizona with patients whose children are doing decades in prison for marijuana, and now we have dispensaries, and you can actually get CBD infused mouthwash. Okay, but why are there still people locked up in cages for doing something that's now we're talking about? Hell, we're going to make a cannabis mouthwash. I mean, it's just the management. The management is so incompetent.
Because people won't take a stand. I feel like until it comes directly to your community and becomes a problem in your community, then it becomes a national problem. There are more, but this Black Lives Matter movement has so many arms. It's not just about police brutality. It's about the fact that there's a mass incarceration problem in this country with people of color for crimes that are now being committed that are legal. Why are you still holding these people behind bars? So people are protesting, hoping that they can get these congressmen and women, council members, depends on how your state is being ran, governors, to understand that if you have legalized these things, all of these people need to be set free. You have no legal reason to leave these people behind bars.
So why are they left behind bars?
Because they don't want to have to pay restitution.
It's a jobs program.
Restitution and prison system is a big business system.
All right. Money's the answer. What's the question?
A lot of money in that business. So it's one or two things. I say it's both things. You don't want to have to pay the people that you locked up, and you don't want to lose the money on a system that you created that is $1 billion system. So either way, there will be money lost, and they'd much rather keep their money than to be accountable. Period.
Yeah. I mean, and then even go to the opioid epidemic. The opioid epidemic. Okay, so they make all these laws that you can't go to the dentist and get a prescription for Vicodin or Percodan without all this damn paperwork and everything. And they just make it completely impossible to get a medical grade opium. So what do the poor and the addicted suffering from mental illness and addiction and poverty have to do? They have to go buy it off the street where it's made in a bathtub. And then they talk about, oh, this poor pandemic. Poor pandemic, so that the DEA can have 50,000 people that live this great job and have all these benefits, and then lock them up, put them on all these jails, more jobs. It's all job creation. And then they act like, oh, it's so sad that 50,000 people have died. No, you killed 50,000 people because they couldn't go to Walgreens and buy it. They had to buy it out of a bathtub. And you're not about to close down the DEA and cancel all their pensions. You're not about to close down, this country has more people in prison than any country on earth. I mean, Mao Zedong and Stalin never had 3 million people in prison. And it's such a scam. What's hard for me is just to keep my 4 boys. My brother, he went to Sydney, Australia. And it's like, and I won't leave. It's like, no, I will stay here and fight the fight internally. I'm not going to shove it under a rug or go someone else. And I tell my boys, you loved being born in Phoenix. You had all these roads and bridges and highways and telephones, and your job is to make it better for the next generation. But my God, it's just so challenging that I have to read that poem anyway to myself every morning. It's like I feel like I live on the planet batshit crazy. You know what I mean? And I just wish batshit could just be a little less crazy.
If you're living on it, then I'm the ultimate star.
Are you? But you're a binary star. Who are you? Who are you circling with? I got it. Why don't we we'll start the Binary Dental Star Association, and we can just spin off into the universe, bitching and moaning and complaining. But then I tell my boys, I say, you can bitch and complain and moan all night long, but then in the morning when you wake up, that problem's still going to be right there at 8 o'clock. So what is the long-term solution? And what I like you're doing is lowering expectations, because nothing's going to be fixed in an hour or a day. I mean, my God, I can remember in the 7th grade when they told us that the telephones we have, that we would be able to see the person on the other side because they were going to combine the TV and the telephone. Well, it all came true, but I was told that at like 10, and it actually happened at like 50. So it took like 40 years to just do that little thing, of putting those two things together. I can't believe that in America they had silent movies and the phonograph for 40 years before one person thought maybe we should add that together. And I don't even want to tell you how long it took to add chocolate to peanut butter. I mean, they should have just come up with that the first day. So things just move as slow as glaciers, and it's hard to stay motivated when everything just takes so long because people are so crazy.
I agree. No, I agree. I just think at some point, I understand that not everyone is going to be an activist, and not everyone is going to be an advocate. If you're not willing to be an activist, I always tell people, try to be an advocate for yourself. But if you're going to advocate for things, do your research on what you're advocating towards. Don't go and complain without having the data or references to back it up. Period. We can bring about change. Like you said, look how long it took for them to bring those items together, right? But all it took was for one person to come up with the plan. And he had to get a few people to believe in the execution. So all it takes is you have the plan for how you think you can bring about the change. If we get enough people that are just willing to back it up, hence advocate. I am not your typical advocate, activist. I will not be the one that's standing and protesting with the sign and putting my life on the line. That's not what I do. I'm behind the scenes. But again, just because I'm not a forefront activist does not mean I'm not a behind the scenes activist, which makes me more of an advocate for change. I'll do what needs to be done. If I got to write letters, if I have to call my council members and complain, which is what I did during COVID, because I just didn't like the way I was treated. I didn't like how, people lost their jobs and you tell them that they still have to pay their rent. Here in DC, you told the residents that you don't have to pay late fees and your landlord cannot evict you. But here's the problem. After 3 months, the landlords were given permission to evict you. DC City Council had to have an emergency meeting to overturn that ruling because they knew people were being evicted the minute on July 1, landlords were in court. How do you do that to people? But I saw that that was going to be a problem. I kept saying, forgiveness. How can people give you something that they don't have? At the bare minimum, ask people to pay for their electricity, ask them to pay for, their water. Figure out what their income source is. Let people be accountable so that you can assist them. But to not provide any assistance, and then you have all these people on the street and you're wondering how you're going to feed them, and you're like, oh, well, not my problem. That's not the solution. And so we need more people that are willing to be advocates for change. Doesn't necessarily have to be activism, advocates for change.
And they just have no imagination. Like, I'll remember, my gosh, oh, I got to go back. I'm not remembering it. But it was during, it was during the Great Depression when the U.S. president passed a law. I think it was in like 1933 or 1932 or something. And I mean, we were in the middle of a Great Depression. He just refinanced everybody's house in one law. He wasn't going to wait till Shirley and Howard and Paul went to their bank and everybody was, just chaos. He said, I'll show you how to refinance your house. And he refinanced them all in one law. Again, you have so many examples of enough people back in time or white or whatever where, again, I just think 80% of the 8 billion humans live, at least 80% live under incompetent management.
And that's what we need to change.
I can't believe I was supposed to talk to you an hour. We're at an hour and a half, but I still got one final question that I take issue with Takeisha. Not only but seriously, you just got to live underneath your means. You can't spend more than you have. Do you think dentists, physicians, and lawyers have a ongoing problem of spending more money than they make, as opposed when I go to small town poor Kansas, it's like they save more money and they cook, they just live below their means. But it seems like, do you think dentists and physicians and lawyers, well, let's just stay with dentists. Do you think dentists have a problem with living above their means more than the regular people?
Yes, I do.
Yeah.
Yes, I do. And here's the problem. Society convinced us that there was going to be wealth with medicine, with those professions that you just mentioned. If I became a doctor, I was going to have money. The problem was when during your time or, you first decided to be a dentist, the cost of education was a hell of a lot cheaper. It was a cash industry. It wasn't insurance driven. So you guys were making money. And so you could make the money and buy the real estate and buy all the different things, right? Let's fast forward 20 years later, 30 years later. Our industry now, somehow or another, we allowed it to become insurance driven. The cost of education has skyrocketed. But all we remember is if you were a doctor, you got to have the Land Rover. If you were a doctor, you got to have the Porsche. So the problem is we're living in the past. And then also we've worked our butts off. We want just something tangible to make it look like we have the part. But here's the problem. In being, as we call it, house rich, pocket poor, in being house rich, in looking the part, we're contributing to society believing that we are wealthy. There's a small percentage of professionals that are wealthy in our profession, a small percentage. The rest of us are just trying to figure it out. So I do believe we do live outside of our means, but you need to have a plan. And I even look at my practice. I put everything on the line to open up my practice. I came up with a plan. I came up with a 5-year debt-free plan. People see me living and I'm like, oh no, you don't realize those are the luxuries that I bought before I decided to open my practice. I'm living below my means. If I was living above my means, when COVID came, my practice would be in bankruptcy. I built my practice out because I was smart with the money. I did not get the support that was needed from the system. Now, unfortunately, that affected my 5-year plan. But guess what? At least I'm not filing bankruptcy. And I had enough sense to say, because in my head, get rid of all of this debt in 5 years so that in 5 years, if I'm making $80,000 a month, 90,000, 20,000. It's mine. I don't answer to PNC. I don't answer to, Bank of America. I don't answer to any of those financial institutions. So yes, we do live outside our means. And now is the time for us to start looking and being the part of broke. It's okay. Say you don't have it, even if you got it. Say you don't have it.
Yeah, and you said big house, little pocket? Or is that what you said? Big house, little pocket?
Mm-hmm.
Yeah, in Kansas, we'd say big hat, no cattle, Big old cowboy hat, no cattle. And, so take it from Astaire Overeem. Did I say his name right? As Ollie Stair? Ollie Stair? What does he just go by, Ollie?
Yes.
So just be like Ollie and knock out the spending, man. You just, and I say this and they look at me funny, but like around here, like I know their dad, you know what I mean? And I'm like, okay, you just come out of dental school, $400,000, go back and live with your mom or dad and you can live for free. And they're just like, well, I don't want to do that. Well, I don't think 6 million people wanted to be shipped off to World War II. I think some of those guys in the boats were like, I'd actually like to turn around and go back. I mean, I don't care what you like. I mean, you're $400,000 in debt. You're in the middle of a pandemic. Jobs have disappeared for associate dentists with no experience. Yep. And your dad is a frickin' dentist. And I know he's got extra rooms because I've passed out in him before. Just go sleep in one of those beds. You know what I mean?
Can I tell you, this is so funny because I literally had this conversation with one of my really good friends yesterday. My testimony, I actually lived with my dad for my first 7 years as a dentist. I left my dad once I decided to get married. I'm happily divorced, but I left once. And so what people don't realize, like you said, you have all this debt. My parents understood I had a lot of debt and they afforded me the opportunity to what? Stack my paper and get my debt down. And if they told me to pay them $1,000 or whatever they wanted, I knew that was nothing compared to what I was making because they understood I had a plan. So I'm with you. I am a huge advocate for staying with your parents, staying with any relative, or getting roommates, finding a way to minimize your overall expenses so that you can save to be debt-free. Because I'm telling you, what you don't know is that in our profession is designed to keep adding on debt. They will keep giving us debt. Oh, the practice needs a new pan machine. Well, guess what? The pan machine is $100,000. Oh, the practice needs new chairs. Those chairs are $50,000. Our profession is designed, and again, you want to talk about, just the government, but I feel like the dental vendors that run our industry, and I don't know if you have any sponsors. I'm sorry if I'm going to offend them, but they ought to be ashamed of themselves. They ought to be, because they know that they are in control of things. And so they set our equipment and our supplies at ridiculously high prices, knowing, guess what? We can get the credit to get it. They know that it doesn't make sense.
Yeah, but I just want to say one thing to clarify. You said, hope I don't have any sponsors. I have a media company and a magazine. Mm-hmm. And they keep a yearly list of all the ads I ruined by either saying something in my lecture, my column, now my podcast. So they call me the anti-salesman. So yeah, I mean, because they're like, dude, we had this in the works. They wanted to do an ad. Then look what you said. And I said, well, you know what? I'm not lying to my homies. I mean, I'm telling the truth. And by the way, they don't want to go home and live with their parents. You realize that I lived with my identical twin brother for 4 months until I just couldn't take it anymore, and I ate him. It was in the womb. We weren't born yet. I ate my twin brother in the womb, but I did what I had to do. I had to make room, and there was... Yeah. But hey, I could talk to you forever. Thank you so much for coming on the show. And my God, you went, we almost talked for 2 hours.
It doesn't feel like it.
But really, I just loved your honesty, and I mean you're I'm Dentistry Uncensored, and you're no holds barred. I mean, if Takeisha thinks it, she's gonna say it. And thank you so much for coming on the show and giving me 2 hours of your honest life. And I can't wait till this pandemic is gone so we can go try to drink our way across the river. We'll try to row across the Potomac while drinking Jameson.
Get for that. Look, I'm known for a good cocktail.
All right. All right. Well, you got to make me one.
I'm out. That's a promise.
All right. Thanks so much for coming on the show.
It was my pleasure. Thank you so much for having me.
Okay. Remember, if you have a daughter, you have to name her Take Issue With.
That's going to be her nickname. And I'm going to say, hey, you have your uncle to thank for that one.
The founder of Howard University. They named it after me. Don't forget that part either.
Oh, bad.
All right. Have a great day. I got to run.
Thanks to you, sweetie. Bye-bye now.